Okay, so we were just talking about, Thousand Oaks, born and raised, and you said because there's a lot of family, there's friends here, that was kind of the reason why you stayed here and you decided to go anywhere else outside the state.
Right.
And college-wise, now you went to UC Berkeley of optometry. Why did you choose UC Berkeley?
UC Berkeley, number one, was in California.
Mm-hmm.
I was a California resident, so
Okay.
that always helps out as far as tuition goes. But it has a great reputation. It is one of the schools that's harder to get into. They have a smaller class.
Mm-hmm.
Of course, that was 10 years ago, but things change. Tuition's gone up since then.
Mm-hmm.
But that was my underlying kind of wanting to go for it. In fact, I wasn't done with my undergraduate work yet, and I thought, you know what, let me just apply, and if I knew that I could switch a few things, because you only have to have prerequisites, and if I could switch a few things, if I got in, then I would go. I would go, ahead of schedule type thing. But if I didn't, then I would kind of finish out my current graduate degree.
What other field would you have gone in if it wasn't for optometry?
Well, at that time, I knew I was going to optometry school.
Oh, okay.
But as far as you don't have to have a specific undergraduate degree to be accepted. In fact, you don't even have to have an undergraduate degree. But by the time you take all the prerequisites, you basically have a science degree. So
Really?
Oh yeah.
So wait a minute, so optometry is all about science? So I would have to really take my classes in science in order to be qualified to...
It's almost the same prerequisites as medical school.
Okay.
Going to medical school. So you've got chemistry, physics, organic chemistry. You've got the psychology. It's the same thing.
Oh,
You've
right,
got the math.
Okay.
You've got the calculus. I mean, it's the same stuff.
Well, now, when did you open up your practice?
Well, right after I graduated, I worked for other doctors. So I was in the Valley. I was in Oxnard.
Okay.
So different areas. I was going to a different place every day. And basically because I thought, I want to start working. I've got these loans to go for, and found out that wasn't where I wasn't happy. And I was happier knowing that I was, building a relationship with a patient that was going to stay with me, whereas working for someone else, I didn't have as much invested in it. And so I started looking for practices to possibly buy. There was a doctor here in Thousand Oaks that he wanted to sell his practice. No one was buying it because it was just not in, it wasn't in great shape, but there was potential there. And so,
do you find that to be kind of, is that common with in the line of field that you're in? Do you find that where people are, they work for a few doctors here and there and they say, you know what, I just want to do it on my own? Is that kind of...
It depends on the personality. Because I know optometrists that they're perfectly happy working for other doctors. They don't have to worry about, the payroll, they don't have to worry about all the other business part of it. And honestly, that's not my favorite part, but it's I like the autonomy of being able to do, control my schedule, and as my kids get older, be able to schedule around their things so I can actually be there.
What challenges did you face starting up your own practice? Here, it's always been here in Thousand Oaks, right?
It's always been in Thousand Oaks.
Okay.
It's a different location, but the main challenges are getting the financials set up, being able to have cash flow, being able to try to draw in new patients. Similar business models to almost any business. I mean,
Sure.
Similar principles.
Okay.
Having a specific job, meaning taking care of people's eyes, that was a little bit easier because I truly believe that everyone should have their eyes checked, keep them healthy. It's not like you just need it when you think you need it type thing. So it was something that I felt strongly that people needed to have done.
Well, yeah, we definitely need to see, don't we?
Yes.
Okay, so what is Optomap retinal exam? Tell me a little bit about that.
The Optomap is something that came out about 5 years ago, and it came about from a scientist whose son had a retinal detachment that went unnoticed.
Okay.
And just because he was young, in the past, before we had this technology, we would have to do something called dilate the eyes. We put a drop in the eyes, the pupils get big, so that we can shine a light in there and check the entire health of the retina. If we don't dilate, pupils get smaller, so we can only really see the center portion of the retina. So This came about because this scientist, his son went blind in one eye, and he's like, there's got to be a way to check farther out in the periphery without, dilating, or people that can't be dilated, or kids that don't want to be dilated, or for whatever reason. And so he invented this instrument, this technology, and so now we can take a digital picture, we're in the digital age, a digital picture about 200 degrees on the inside of the eye without having to dilate the eyes in most cases. We still dilate if there's some specific symptoms that are going about, or if it's been several years we want to look at something, but it's allowed us to have the technology to be able to see the whole retina without dilating, and be able to catch things that we weren't catching before.
How often what would you recommend? How often should you get examination for something like this?
Well, we recommend having the eyes checked for health reasons every year.
Any specific age, or?
When you're younger, you're not having any problems, it could probably be every 2 years. Mm-hmm. By about age 40, mm-hmm. The eyes go through a change, and we recommend from there on out probably every year, just to make sure that everything's normal.
Because there's hereditary too.
If there's risk factors, then yeah, it might be more often. So
I see. Yeah. Okay, so you say close to around 40. Okay. Actually, what do you think about the technology that's changing the eye care industry?
It's great. There's so much out there that if you don't embrace the technology, then you get kind of pigeonholed into maybe someone that's not willing to go forward and have the best diagnostic things to be able to detect things and to follow disease, to detect eye problems. So as far as technology goes, it's just getting better and better. We're going electronic with records. We're able to see layers of the eye that we couldn't even see before.
Do you think it's possible to reverse blindness with this new technology? I mean, it's crazy now what they have. So
it depends on what causes the blindness. So I would say yes to certain things that might be causing it, but blindness can be caused by a block, light not getting to the back of the eye, or it can be caused by the actual retina deteriorating.
Do you think it ever could be, do you think it could ever be fixed just by?
Well, I think that there's technology that can definitely aid people.
Or because of it'll start looking fuzzy, where they actually can see a blurry picture sort of thing, and then eventually maybe they can make it, HD quality.
Possibly, but someone that maybe you've already researched him, but I forget his name, but I attended a conference. He is blind, and he's climbed every mountain in all the continents as far as I know, and he showed a video of him climbing Mount Everest, and he's totally blind. And he is an inspiration. And there's some technology that he was showing, it's all brand new. He would put something in his mouth. He'd have a camera on his head, the camera would transmit a signal, and it would make impressions on his tongue so that he could visualize shapes. Now he couldn't see clearly.
In front of him?
He could, by sensing the shape on his tongue, he could, like he's a rock climber, a mountain climber. He had this camera on, he was on a rock wall, and he could look and he could see exactly where the handhold was by this camera transmitting to his tongue. And that was really cool.
How long ago was that?
I was there in April.